Since the time COVID happened in the year 2019-20, every country is focusing on bettering its healthcare facilities for the people. Hello and welcome to the In Focus series section of Drishti IAS. I am Aisha Singh, and in today's video we will be discussing about the latest national health account estimates for the year 2019 or 20 or till the year 2019-20. So let us first look at the timeline. First we'll be looking at the news, then what are the major highlights of the reports, because this is the most important. Then our prelims MCQ. This topic is of relevance from General Studies paper 2, which is health. Very important from mains perspective and also from the essay perspective, and it has been seen that in prelims also the facts related to this report can be asked. So let's see the news. It has been taken from Indian Express, and this says what the latest national health account figure, and they are the latest one which has been published, say about India's healthcare sector. So after the 2019-20 COVID, the main focus has been on the healthcare, because when it came to when we talk about the second wave of the COVID in the year 2021, what we saw was the collapse of the healthcare facilities, not only in India but all over the world, especially in the European countries, and then in India, and when it comes to global powers like US also. So what has the report said? So what has happened is the National Health Account Estimates 2019-20 has been released recently, and this National Health Account Estimate talks about country's total expenditure on healthcare. So important line, that this talks about country's total expenditure on healthcare, be it government, private, public, how much the country has overall has done its expenditure on the healthcare facilities. And this is the 7th such report from the year starting from the year 2013-14 to 2019-20, and this is produced annually by the National Health Systems Resource Center, which comes under the Health Ministry. This is an important point, that this comes under which ministry? So Health Ministry. And second, who publishes it? And the accounting framework used for the National Health Account Estimates is Internationally Accepted System of Health Accounts 2011, which has been recommended by the WHO, that is World Health Organization. So important word is, it started in the year 2013-14. It talks about country's total expenditure. It is not only talking only about the government expenditure, it is talking about the total expenditure. So total expenditure includes government, private, public, NGOs, civil societies, every single thing. And then it comes under the Ministry of Health. Now let's talk about what are the few of the very important highlights of this report. So first and foremost being the government spending on healthcare. So what has been the government's spending on healthcare? Only the government we will be discussing here. And government spending on healthcare has been on the rise. It means that over the years the government spending on healthcare is increasing, and the money spent by government on healthcare has increased from 1.13% in fiscal year 15 to 1.35% in fiscal year 2020, and that is in terms of the percentage of India's GDP. So it means the total percentage of India's GDP, 1.35% has been dedicated for the healthcare facilities, and over the year this has increased. So if we will see that when it comes to percentage terms, 1.13% and 1.35% is not, the difference is not very much, but this little percentage, when we will talk about in terms of numbers, then this point percentage numbers will become very huge. So what is important for you to know, that the trend over the years has been that the government spending on healthcare has been on the rise. In exam, it is not, the examiner is not going to ask you that for every single year what has been the spending by the government. The numbers won't be asked, but what is important for you to is to look into the trends, whether in the last 5 years from 2015 to 20, whether there has been an increase or decrease, or increase and decline, both is happening, or continuously it is increasing or not. So what is important is to look after the trends. Then the per capita health spend of the government has increased from rupees 1108 to rupees 2014. Per capita health means that on one single person how much the government is spending. So earlier in the year 2015 it was spending around 1100 rupees, but now it has almost doubled to 2014 rupees by the year 2019-20, and the target of 2.5% investment in healthcare by the year 2025. So what is India's target by the year 2025? Percentage of GDP, that is 2.5, and what is the percentage we are spending now? That is 1.35. Then the government's share in the total money spent on healthcare in the country went up by 12.4% point between 2015 and 2020, increasing from 29% to 41.4%. So what overall you need to know, that it is increasing, per capita spending is also increasing. Now look at this chart. This chart also tells us about government spending on healthcare. So if you will see that this is year 2014 to 15 and this is 2019-20. So if we will see that earlier it was 1.15, then 1.18, 1.22, 1.35. But then in the year 2018-19, we will see that there is a decline from 1.35 to 1.28. It means in the last 5 years, that is from the year 2015 to 2020, continuous increase has not been there. The important word here is not increase. The important word here is continuous increase. Continuous is the important word, because if you will see that continuity is not there, for 1 year there is a decline. And then again in the year 2019-20, the spend has been 1.35% of the GDP. Now let's talk about the second highlight point, that is money spent by people from their own pocket on healthcare. That means that what happens in India is that whenever, because we people are not very much aware about the medical insurance, and not very much good percentage of our country is included in the medical insurance or health insurance segment. What happens in our country is whenever a person falls sick and is hospitalized, what happens is we tend to pay from our pocket, and the medical bill or the medical expenses is way too high, and which causes a lot of strain, and which puts a lot of burden on our pocket, and which makes us weak financially, and which can a chronically ill disease can either destroy a whole full complete family when it comes to financially, because the financial burden of healthcare facilities is very high in our country. So what the expenditure that we are doing from our own pocket is on a downside. It means it has been decreasing. So the money spent by people from their own pocket on healthcare has been going down, which is a very positive sign and a good news overall, if I will say. Then if we will talk about the year 2019-20, then 47.1% of the total spending on healthcare came directly out of people's pocket. It means 47% of people is still paying from their own pocket. But when we talk about the year 2015, then 15.5% drop from 62.6% of the spend coming out of pocket. It means from the year 2015 to the year 2020, we have seen a drop or decrease of 15.5%, because earlier it was 62.6% people who were paying from their own pocket, but now the number has come down to 47.1%. And what is the aim of the government? So the aim is to bring this down as low as possible by investing in public health and the insurance scheme, example being the Pradhan Mantri Jan Arogya Yojana. So if we will spend, or the government will spend more on public health and insurance, then the burden lying on people's pocket would come down. Look at this graph. The yellow line talks about out-of-pocket expenditure from people. So if you will look at the year 2014-15, then it is 62.6%, as I've told you. And then in the year 2019-20, it is 47.1. It means there is a decrease, which is a positive sign overall. Now let's talk about the third point, which talks about major chunk of the government's health spend was in the primary sector. So it is divided into three sectors, that is primary, secondary and tertiary. So what is primary sector and what is secondary and what is tertiary sector? Primary sector, if we will talk about, then they are the first window officers, you can say, or the first line of officers you get in touch whenever there is a medical urgency which takes place. So many a time you will see that the medical camps are going on around you. So these are basically the primary sector, and which talks about whenever you have fever or cold, cough and you go and take medicine, then there is primary sector. And when the disease gets increased and the primary sector people or the primary sector healthcare facilities then forward you to the secondary sector and you go to the hospital and take medicines regarding it, then it becomes a secondary sector. And when a person gets hospitalized and have to be tackled through the specialized medical advancements, then it is tertiary sector. So the major chunk of the government health spend between the primary, secondary and tertiary has been spent on the primary sector, which is also a very good step and is a positive step, because if the primary spending, the primary healthcare facility spending would increase, then automatically the spending on the secondary and the tertiary sector would lower down, because it is the primary sector, if not taken care of properly, might lead to the increased problems. Then in the year 2020, out of the total spending by the government, 55.9% went to primary care, 29.6% went to secondary and 6.4% went to tertiary. So if you will see that it is almost everywhere half. Primary is 55.9%, secondary 29.6% and tertiary 6.4%. While on the other hand, in the year 2015, the government spending on the primary care was 51.3%. It means in the year 2020 it has increased. Then on secondary care it was 21.9%, which has also increased. And in the tertiary sector, earlier it was 14%, but now it has come down to 6.4%, which is also a very positive news. Now look at this chart. If you will see, blue line is the primary healthcare, orange line is secondary and gray line is tertiary. So in the year, if you will see, primary is 51.3%, which has come to 55.9% positive. Secondary has earlier 21.9%, which has come to 29.6%. And then the biggest positive was tertiary, earlier was 14%, but now which has come down to 6.4%. It means the hospitalization rate overall has decreased. Now let's talk about the 4th point, which is consistent increase in social security expenditure by the government. Important word here is consistent. Consistent means that over the years, from the year 2015 to the year 2020, every single year the expenditure has increased. There is not even a single year where the expenditure has decreased between 2015 to 2020. And it has increased from 5.7% of the total spending on health in year 2015 to 9.3% in the year 2020. It means in the year 2015 it was 5.7%, but now it is 9.3%. It means the continuous increase has been there. Look at this chart. This talks about the social security expenditure by government over the years. So in the year 2014-15 it was 5.7, then 6.3, 7.3, 9, 9.6, and in the year 2020 it is 9.3. So continuous rise has been there, if you will see. Then the next point is increase in spending on insurance. This is a point where the majority of the country, or I would say it is not even 60% or 65% in our country that the people are insured. We are lacking very much when it comes to the medical insurance sector. Now let's talk about the spending on insurance. The privately purchased health insurance has increased from 3.9% of total health expenditure in 2015 to 7.72. So from 3.9% it has increased to 7.72%. in private insurance, while the government financed health insurance spending has also went up from 3.8% to 6.37%, almost doubled. So the medical insurance, be it government or be it private, both are on a rise, which is also a positive sign overall. Now let's talk about the sixth point, that is health spending by states. How much is the state spending on health? As health is a state subject, so majority of the burden about taking care of the health lies on the state. So what is state doing overall? Then there is need for the states to increase their contribution towards the health care, as it has been said in the National Health Policy 2017 that the target should be for every state that 8% the states should be spending on the healthcare. Only 2 big states and 3 of the small states have crossed the 8% target in the year 2020. That is Delhi spending 18.7%, that is the highest. Kerala 8%, Puducherry 10.5%, Meghalaya 8.9%, and Goa 8.7%. So these are the states or the union territories which have crossed the 8% target which was given in the National Health Policy 2017, and all other states also needs to follow them and increase their healthcare facilities or burden. Now in the end, it's time for the prelims MCQ, and you people need to tell me the answer in the comment section. And this says, consider the following statements. Government spending on healthcare has continuously increased in last 5 years. So when I say 5 years, it means from 2015 to 2020. And in last 5 years, there is consistent increase in social security expenditure by the government. Important word that you need to follow is continuously and consistent, because these are the words which will actually tell you that how the UPSC is also asking you questions. This may look very easy, but this is not easy. To try to solve it and give me the answer in the comment section. You have to tell about the correct statements, and the codes are 1 only, 2 only, both 1 and 2, neither 1 nor 2. So that's all for today. Thank you so much for watching. Till we meet next time, keep reading and keep writing.